All right. Good morning, good afternoon, good evening for everyone joining us today here at ZEDEDA Transform. Would like to welcome you to today's session on remote monitoring, health and safety. Joining us today are two great presenters from SAS and Supermicro, and I would like to request them to introduce themselves. Paul?
Yes. Hello. Hi. This is Paul Vendetti. I've been with SAS for over 5 years, and I'm an IoT principal industry consultant for the past 3 years. Prior to joining SAS, I'd spent 26 years working for GE. In my current role, I spend most of my time working with SAS partners and end clients in support of digital transformation initiatives that involve machine learning, artificial intelligence, and IoT analytics. And I'm very happy to be here today to talk to you.
Jeff?
Hey, good afternoon, good morning, everyone, wherever you are. My name is Jeff Sharp. I'm director of our Embedded Solutions organization. Our key focus, of course, is edge-based technologies, including multiple market verticals from Industrial 4.0 to 5G areas and transportation. I've been in this industry, I wish I could say 2 to 3 years, but unfortunately I'm an old guy, so I'll say 35 to 38 years. And setting up great ecosystem partners such as ZEDEDA and SAS.
Perfect, Paul. Thank you so much. Really want to thank both of you for joining us today. Just before we get started, I wanted to highlight the joint solution that we have for health and safety. Over here, this architecture is what we will be talking about throughout the day and throughout this session. And what it highlights is the hardware from Supermicro, leveraging the applications from SAS, with remote orchestration capabilities from ZEDEDA. Having said that, and trying not to steal their thunder, I'd like to go ahead and request Paul to get started on their presentation now.
Thank you very much. Let's get started. So, the question is, how can we get back to normal in the safest manner possible? But before we start to suggest ways we can do that, I want to start first by quickly framing our current situation in 3 dimensions. First, scientific. I'll refer to this as the human toll. The outcomes we are concerned about include mortality, positive infection counts, hospitalizations, and within that ICU capacity, and as of late, longer-term medical issues that have become known as an impact associated with COVID. The second dimension is economic. This is the financial toll. GDP, which serves as a comprehensive scorecard, is one such measure. Business closures and unemployment are others. Growing food lines also speaks to the hardships that people are enduring, very concerning. And then the third dimension is social. And by social, I'm referring to society's response to the science and economic impact. And this includes the trillions of economic stimulus from our federal government, guidelines from CDC, along with state and local mandates to contain the community spread of the virus. Social includes more than just government responses. It also reflects the behaviors and actions of people. And it's these behaviors that are some of the most important early indicators for the future trajectory of this pandemic. And with this as a backdrop, let's take a closer look at one industry where these 3 dimensions have been playing out. Next slide. The meat processing industry in particular has been hit hard. This is a $213 billion industry with over 474,000 workers in the US alone. And if we look at those 3 dimensions I just mentioned previously, on the human side, there's been some work that CDC's done with these facilities as they started having their outbreaks in the March timeframe. And for these facilities sampled, the percentage of workers with COVID ranged from 3 to 24%. And what I found really interesting in that is that there was even some additional work that was done by CDC with 7 facilities in particular that implemented system-wide testing. And what they found was the asymptomatic positive infection rate was 14.4% among the tested population of over 5,000 workers. This virus being present in this stealth mode helps explains why the spread was so rampant in that particular industry. This industry has been studied, and there are many reasons why they are ripe for spread. But one leading reason that's pretty obvious is it's a workplace where you have densely packed workers side by side, sometimes elbow to elbow, certainly less than 6 feet apart for prolonged periods of time, as these work shifts in this industry tend to be long, 10 to 12 hours in duration. On the economic side, with having to shut down to deal with the human side of this, the economic impacts were also equally painful. And what we saw was almost in a matter of weeks, supply chain disruptions. And as an example, one example of it was by like May 5th, I think Wendy's stopped serving beef hamburgers at about 20% of its 5,500 restaurants. Grocery stores also experienced shortages, and consumers have still been experiencing higher food prices today. And then the society response. On April 28th, President Trump issued an executive order declaring meat processing facilities an essential service. CDC guidelines and OSHA guidelines quickly followed, specifically for meat processing facilities. And while many facilities remain open now, several are operating with limited production, and others have had to shut down for weeks at a time for deep cleaning. Workers showing up sick due to financial concerns has also been reported. So what does all this suggest? Next slide.
So Paul, that those numbers are pretty amazing. So throughout your presentation, you're going to kind of give some additional examples other than some of the meat packing attributes, correct?
Sure. Yeah. I mean, I kind of interject that one. That was kind of the one industry example that, I thought, again, showed it in industry, but it's certainly happening, in many other locations as well.
So Paul, as we're waiting for Shay, do you want to talk on the next slide and hopefully he'll catch up?
Sure, we can do that. So basically, I kind of talked about the industry, the macro factors happening on the higher end, and then also the meat processing industry. But really, what we're talking about is the serious hardships being experienced on both sides. What's next is really the health and the economy situations having to be dealt with. And for us to return to normal as safely as possible, we're going to need to balance a tightrope very carefully between these two things as they're interrelated. And I think another good example that illustrates that interrelationship is the 4 phases being used by the states in reopening the economy. As you have positivity rates in communities and hospitalizations, there's only certain things you can do with businesses in opening. So what I was meant to show here, which you had a visual, which is again a tightrope, a person trying to balance these two things. And I think that's an important perspective that plays to what I'm going to be talking about next. So how can analytics help specifically? So what I want to do is briefly introduce analytic platform from SAS. And over the last 40 years, SAS has been helping clients around the world make faster, better business decisions with analytics. And our analytical capabilities are well positioned in the fight against COVID, that we have repeatedly used our platform to solve a wide array of business problems. Data, discovery, and deployment represent a SAS viewpoint on analytics lifecycle. We help accelerate this lifecycle in a few ways. Streamline and automate data connectivity and data preparation. We utilize a wide variety of analytic techniques and languages. In scaling and automating and deploying analytics as the third piece. Deployment is one area in particular I wanted to emphasize in the fight against COVID. One of the adages I'll keep referring to is speed saves lives, and being able to deploy and redeploy improved models quickly is essential to getting actionable insights that drive the desired results. And we'll touch more on this shortly when I talk on some examples. But the next topic is, where do we go to look for data? So on the science side of the equation, we turn to the CDC organization, whose purpose and mission is centered on public issues like COVID. There are a half a dozen to a dozen items that are certainly noteworthy if you looked at what CDC publishes as things to manage during a pandemic like COVID. And the CDC continues to evolve this list and priorities as they learn more about the spread of this virus. As of late, the National Health Team has been promoting what they're calling the 3 Ws as a way to get this to stick in our minds. And they are: watch your distance, wear a mask, and wash your hands. There are many more items on the list, but I'll stick with those 3, hoping that message sticks in your minds. Now let's take a look at some examples that focuses on the science of what we're trying to do. So I think you're a few slides ahead there, Nathan. If you back up
Oh, I'm
a
sorry.
couple
What
slides
slide?
with the conceptual solution slide.
Okay, very good.
Thank you. Yeah, that one. So kind of as I stated a moment earlier, SAS Analytics helps provide a modern approach to the pandemic problem, and we help in four specific ways. First, we provide a centralized approach to managing all types of data, structured and unstructured. We gathered any and all data that helps provide necessary context and what we call situational awareness. Secondly, as you'll see from the examples I'm about to show, we enrich this situational awareness with real-time IoT data to get real-time insights. And thirdly, when decision latency matters most, we can provide real-time alerts and notification to whomever needs that information. Now continue to beat that message. When it comes to COVID, speed and faster decisions can save lives. Lastly, we provide the insights needed for actionable intelligence. And examples of that include engineering controls, such as signage to direct pattern flows to set up cleaning stations, administrative controls on how and when to clean disinfect areas as examples. So now with that, let's take a look. We'll start taking a look at some of these examples. If you turn to the next slide. There you go. So in normal business times, we would be discussing how we use computer vision in industrial settings to automatically detect product quality in manufacturing or optimize shopper experiences in retail. Relative to health and safety due to COVID, we've been able to leverage available cameras and our analytical know-how to develop computer vision models capable of detecting people, distances between people, and the elapsed duration of these interactions, basically social distancing. If defined thresholds that are set up and defined, and they can be adjusted or exceeded, we can generate real-time alerts and immediate notifications to whomever needs to get those notifications. We also store data that can be used to perform post-facto analysis of these interactions and to determine risk profiles by specific locations over whatever time frame that makes sense. This analysis can inform needed engineering and administrative controls I just mentioned earlier. While the emphasis of this example is social distancing, the technology in this setting is also capable of things like face mask detection, which is another one of the important W's from CDC, and hotspot traffic patterns, which could be indicative of areas that have a lot of contact with people, which could be insightful for where prioritized cleaning and disinfecting should be taking place. And I will share more in a moment on this specific example as SAS and our partners like Jeff Sharp from Supermicro are working on a deployment of this capability. Next slide. Another, contact tracing is another one of these important use cases that SAS has been very actively working on. And so contact tracing has been a part of public health strategy for managing transmittable disease spreads since the 30s, and is a process that can be greatly improved with a modern analytical approach. And there are two extremes that I want to contrast our approach against. In China, during the early outbreak, many shifts of teams, with each shift having as many as 1,800 health workers, manually contacted infected individuals in an attempt to contact trace and isolate exposed individuals. This was published in a WHO report, and what you can read from it is it was, again, extremely labor-intensive manual, and was somewhat mixed in terms of the results, in terms of efficiently finding the people. The lockdown certainly had the effect they wanted, but the contact tracing itself, again, very manual. On the other spectrum, some have equated contact tracing with mobile phone tracking, which by itself is not an answer to contact tracing, even though it can help. And our approach is more centered, SAS approach is more centered around three aspects. One important aspect is what we'll call the contact entity database. This stores contact tracing data, and this is augmented with any additional data that provides what we'll call situational awareness and faster actions. And an example of this could be the daily individual survey data that many companies and schools across the nation are using as part of a return to work and school. And I like to point out that CDC has clear guidelines for this daily attestation survey. So these are the symptoms that people again, would want to be asked and would want to be cleared on. And the benefit of having that data is obviously you can identify risk individuals, and it would speed up and facilitate faster contact tracing, as an example. And that's not the only data, though. There's certainly much more, and I'll talk on that in a moment. The second is enriched data with real-time location tracking sources, like phone, GPS, Wi-Fi, Bluetooth location data, and time duration of entry-exit zones of interest. Schools and also businesses have badges that allow people to get entry and exit into locations. That's another example of capturing data from lots of sources and putting it into a unified repository. And then once you have this data, when that event occurs and somebody's been confirmed positive, the benefit then comes in the form of being able to identify all the direct contacts that might be related to that infected person, but also the inferred ones too. So this is where the third phase of what we provide is important, the intelligent alerting and visualization that contact tracing resources utilize. And you can see that a little bit from the illustration in the slide. We provide visual linkages among the confirmed cases, contacts, and places, pattern analysis that show how these linkages change over time. SAS recently hosted a contact tracing webinar for education where this use case was discussed in detail. Oklahoma State University is using SAS analytics in a manner along these lines and is working in close collaboration with local health authorities to provide these kinds of outputs to local contact tracers. And then earlier today, SAS IoT, in conjunction with one of its IoT partners, Intelligent Locations, also issued a press release announcing a contact tracing solution for hospitals. I personally believe that this is going to gain more momentum and have a greater impact with improvements in testing. And I'm very curious about the recently approved FDA saliva test for COVID. I think this, could really start to make contact tracing and what people are trying to do a lot more impactful. And again, this is a thing about what we're doing in this, in this space, is that everything is evolving on a very rapid way. Next slide. So I mentioned earlier that we could use computer vision to identify high traffic areas needing prioritized cleaning. Well, there's other approaches. It's not just one technology that can do things. I think you'll find from a number of vendors and companies out there, there's probably multiple ways that it can be done. So if computer vision doesn't have access to particular areas, you certainly can look at other approaches. And one of those other approaches could be, again, Bluetooth low energy beacons and gateways that could be, again, used to track traffic. And it's one other advantage of this approach too, is that even if they're not being used by individuals, the janitorial individuals could have these same beacons on, say, lanyards, and could be tracked for rounds that they do to confirm that these risk areas that people are coming in contact with are in fact being cleaned, as expected and when. So it's another piece of evidence that can be captured as part of a holistic approach to managing the COVID response. And again, I think I referred to that as administrative controls, previously. Next slide. So far I shared 3 examples that highlighted the science approach to mitigating the spread of COVID. As I kind of mentioned earlier, there's also the economic side of the equation. And then we equally have many examples where we're working with industry to optimize when they need to operate at less than 100%. Examples of this include medical resource optimization work that we've been doing with the Cleveland Clinic, where again, as they start to reopen, it's not an fully opening scenario. They're opening in phases as well. So again, how do you optimize that with resource constraints that they have, as well as objectives to again make sure that they're doing it in a safe manner for the workers and the patients and in their operations. And then even more recently, with all the news out there with schools, SAS has also been working with schools in the optimization, as many schools are adopting hybrid learning experiences and needed to determine how to optimize the face-to-face instruction time while maintaining adequate spacing. In the example I have here, we are optimizing limited production capacity driven primarily by labor constraints or other supply chain uncertainties due to COVID. We provide rapid update to new data like confirmed supply deliveries, number of people who show per shift, confirmed customer orders, and outbound logistics available for delivery as an example. And this can help businesses dynamically determine how they allocate people, material, machines in production, and what to produce by month, by week, and by day at each shift on each production line. this idea of optimizing what you have for operations when you're less than 100% is a way to, again, strengthen up the economic side for the businesses or schools or hospitals or anyone for that matter as they start to recover from the impacts of COVID. Those again are some examples. Next slide. So now I want to talk in a bit more detail about the social distancing example using computer vision. I've received permission from the CEO of a Rhode Island manufacturer called Water Rower to discuss our work together here today. Just a quick background on Water Rower. Water Rower is a manufacturer of beautifully designed rowing equipment that is used in homes and gyms across the country. Peter King, CEO of Water Rower, has been a true partner with us in the development of this social distancing solution that we're expecting to put into his facility in short order. Water Rower epitomizes the challenges we have talked about today, dealing with a very complicated disease, trying to do whatever is necessary to keep his workers safe from this virus, while operating and ensuring the ability of his workforce to earn a living. And we're extremely happy to have the opportunity to work with Peter and the Water Rower team. Thank you for that intro. Now let's go to the next slide. So our solution that we're working on, this is basically, it comprises of primarily a social distancing monitoring capability, basically the distance and time duration that individuals are near one another. And furthermore, we can define geozones in a given area using the computer vision to ensure that the right number of people are distanced are in a specific area. So that's another feature of what we've been able to work on and deliver here. And then the third piece is having the dashboarding capabilities. And this is, again, the ability to do the real-time alert notifications and also build data to do kind of a post-facto analysis that I'll illustrate here in a moment. These are the main features and use cases that are around our solution. Next slide. So this is kind of the three main elements to the solution. First, it entails building a computer vision model, and what do we need for that? So it starts with video data. So we've received video data from regular security cameras that were already in place in the facility. So we use these raw video feeds to develop our computer vision models for the features that I just mentioned. So these models are fine-tuned and trained to the conditions of the facility where the workers are. And the other key point I want to point out about this is we're not trying to identify specific people. This is anonymous. This is really just being able to look at how they're doing relative to social distancing. And again, and we use that as a tool to help them understand the behaviors of the workers and how that can be conducive to risk of potential COVID spread. And so the first, again, getting the video feed and then using our technology, our SAS technology, in particular the visual data mining machine learning, to build the computer vision model. Once the model is built, the architecture that supports our talk here today is centered around being able to manage the models and deploy those models to an on-prem compute environment capable of running these models, being directly fed by videos. The on-prem solution then has the ability to generate real-time feeds and data to a real-time dashboard to show what is happening today. So by area within the facility, you can see what your statuses are relative to violations or thresholds being exceeded for social distancing. Also has an ability, since somebody might not be sitting there monitoring a dashboard, to send an email notification. So in working with Water Rower in this case, having them to dictate what they want to have happen with email notifications. Who do they need to go to based on which ones they are? And that again can provide the situation, a capture of an image, and they can understand what's happening. And over time, if they start seeing the same thing, that will help them understand the engineering and administrative controls they need to take action on. Summarized data, so that's number two. Number three on the diagram is we then have summarized data being pushed to the cloud. Since obviously it doesn't make sense to move large volumes of video data to the cloud, we just move summarized data. And that data is stored to run what we call post-facto analysis. And I'll show you what that looks like here in a minute. So next slide. So here's an example of what we call a high-level dashboard that can show at a glance how the facility is performing with social distancing. And if you look closely at the diagram on the lower right, that shows you some dots, and there's some red dots in the upper. There's like almost like 4 quadrants, and in the upper left, you see some red dots. That red dots really reflect where the distances are. The distances are too close, and the time duration is too great. And say for CDC guidelines, that is within 6 feet, more than 15 minutes. The one thing about the solution we built is those thresholds are adjustable. If CDC changes guidelines, we can adjust. And maybe certain situations based on the facility, it might be more appropriate to adjust them and make them more stringent. But nonetheless, this provides a quick glance view of where there's issues with kind of a relative score on how many violations, and overall, how many percentage of the interactions are in that risk area. And the green dots obviously show we're also capturing how many times things are going well, which means people are keeping distance and are not interacting frequently. And then there's also this idea of a severity metric, which is kind of a composite number. It's a derived measure of risk relative to distance and time spent together. This is again on a 0 to 1 scale, 0 being good, 1 being bad. And that is a single snapshot. It's not all that meaningful, but if you look at that over time, that again starts showing you your trend. So how are you doing in terms of a trend overall? And then there's also abilities to sort by locations and also different types of alerts. So if again, there are alerts based on face masks or social distancing violations or crowds in too many in geofence areas, that's also a sortable element at a high level. Next slide. So again, that was a high level view. And then what we're able to support also is the drill down view. So obviously being able to get into the specifics of being able to look at the measures on a basis of location, day of the week, time of the day, because there could be some behaviors that are happening again based on shift changes or during lunch breaks, things that again would start to show in the detailed views. And again, this provides us an ability to kind of hone in where there needs to be some attention. So while management can't be everywhere all the time, the technology is, and it's basically being able to generate the metrics and an analysis that helps gain the insights. Next slide. And then lastly, I talked about computer vision being more than just social distancing. So this is, again, an illustration of a hotspot analysis so that, again, in terms of seeing the patterns of people flowing through a facility, able to generate hotspots, which, again, start showing where there's more concentration of people that could be useful for prioritized cleaning, as an example. And then finally, the next slide. So this is not a water rowing machine. You got to go to waterrower.com to see one of those. But I think the analogy is a good one and ironically symbolic with one of the early adopters we are working with. Health, safety, and economic impacts are interrelated and need to be synchronized to achieve the best we can. We've provided some examples of how analytics can help, and these analytical workloads need to be powered by technology. And this is where I want to, again, turn it over to Jeff Sharp, who'll explain how we tie these use cases and analytics together.
All right, thank you, Paul. Great. It's all about the killer app, guys. I mean, that's really what makes all of this happen. And working with SAS, it's just been great because the amount of safety in the workplace, especially using SAS baseline analytics through their ESP program, is working great. And my presentation, next slide, Shay, is really kind of focused on how you take these killer apps that SAS provides and put it onto a infrastructure for edge to cloud. Next slide, Shay. That's really kind of focused on computer vision, heterogeneous based systems, meaning that I'm going to have multiple silicon elements within those systems. And I'm going to focus a lot of the energies really at the edge, because for a lot of these killer apps to work, of course, it's a hybrid effect in which you have edge-based hardware, edge-based software techniques that's also have to communicating to a cloud environment, whether it's a public cloud or a private cloud. And when we're dealing with edge-based components, whether it's at the customer premise or working through the service provider environment, these micro data centers can be placed in a more colo location, whether it's the radio tower using LTE or 5G capabilities, or a central office, or a remote data center. It's all about latency. So when you're getting into these computer vision-based techniques and running these techniques on virtual machines or containers, the means to make these edge components to be more autonomous in nature, meaning that they need to be self-healing, self-managing, self-healing, especially when you're dealing with containers and virtual machines. So Supermicro, along with a lot of our great ecosystem partners, including ZEDEDA, are providing that remote capabilities on how I manage those virtual machines, all in a secure network. Because realize in this hybrid effect, we're doing real-time latency, real-time processing, and maybe dealing with the cloud environment to do training attributes or storage or other areas. So again, that edge to cloud mentality with a greater amount of workloads on one system is kind of our key strategy going forward. Next slide. And with that said, our approach for monitoring for health and safety and a lot of other types of market verticals based use cases, it's really about that artificial intelligence that's in place. So if you think of that AI capabilities, there's really kind of 7 patterns, common patterns within this environment. It's recognition. Again, as Paul said, how can I recognize that, that person coming in the building doesn't have a high temperature, he's wearing a face mask, she's, social distancing, but it's that recognition aspect. Conversation, we're seeing more and more voice-related activities, the Alexa of the world, where I'm talking in a voice recognition, getting responses back to enable, the workplace or safety, so I'm not interacting with each individual human. And then, of course, predictive analytics. As Paul said, through the SAS application, through those analytics, where are the major traffic patterns at that I can ensure that's very clean, there is social distancing, and so forth. Goal-driven systems. What am I looking at doing using AI and learning techniques? Autonomous. How can I potentially open a door autonomously without, having a human doing and ensuring that, people are safe coming in, or ensuring that people are within areas that are safe. I'll talk a little bit more about that. Pattern anomalies, things that, we can patternize to look at where are areas that are concerning for safety requirements. Mining and drilling platforms are awesome types of areas that we can pattern where injuries are occurring, and how can I ensure that the workers are safe based in those areas that they're stepping into. And then, of course, hyper-personalization. How can I personalize this using a common infrastructure, common baseline to build my software up? And in this top right quadrant, our strategy is to have a common workflow, meaning you have incoming either visual data, sensor data, whatever data, and I have a platform that I can build upon to have some types of analytics, some types of response, some types of visualization that I want to use for future areas. So it's really a baseline of hardware, a baseline of middleware, and a baseline of AI functionality that I can use both at the real-time edge and also in the cloud for future analytics. Next slide, Shane. So with that said, next slide. So again, it's really about handling workloads. So a lot of our customer base, we were talking about Water Rower, and there's hundreds and hundreds of more use cases, and the key attributes is we want to do more with less. And by doing more with less, meaning I don't want to have an entire frame, a whole data center at my customer's premise, although being a hardware manufacturer, we would love that. But that creates power issues. Got to have a lot of power. I got to have IT personnel. I got to have the ability to, manage the environmental conditions all of this hardware is going to be placed into. So by doing that, most of this inferencing techniques and most of the low latency applications will be doing at the edge. So a lot of attributes that Paul talked about, how do I do an intelligent entry point? So how do I look at people coming in? Are they wearing face masks? Are they not wearing face masks? Are they wearing proper attire for the safety that OSHA has put into place? We can use computer vision to do that. Also temperatures and infrared and other type of techniques that we can automatically use a turnstile. We can automatically allow these people to come in. And then as Paul was talking about, cleaning areas. So you can use computer vision to highlight post-cleaning and highlight the areas that they may not have cleaned very well. It was not disinfected correctly. So red areas could represent, hey, you need to go back and clean these areas because they're high traffic. These are where people are going to stand and potentially get sick or have issues. And then in a zoning perspective and of course social distancing, and also in areas that it could be deemed very dangerous, you want to make sure that the employees are kept safe. And things like vibrators and the pockets, that if you're in these areas, there would be a buzz or something that happens in your pocket to say, hey, you're in a no entry zone or a danger area. Next slide. And by the way, on this edge to cloud attribute, the cloud is doing all your analytics, your archival storage, all of your learning attributes, and then your edge is doing all your real-time inferencing. And lastly, in this one slide is how we put it all together. So again, it's this building block environment. So Supermicro is taking a building block manufacturing environment using common elements, building systems that can go into environmentally challenged areas or areas that need small fanless-based products and whatnot, in a heterogeneous manner, meaning that we can support both x86-based technologies, GPU-based technologies, hardware accelerators, all of those type of areas in a system, both from edge to cloud. And then with Eve, ZEDEDA's Eve program, we now have the ability to manage all of this remotely. If you think of the edge has to be, again, self-healing, self-aware, self-managing of those virtual machines. Because of course, as you're putting more and more workloads on these systems, you're going to have more virtual machines and more containers on there. So ZEDEDA does a great job of managing all of those applications that will be working on that. And of course, the real attribute is that killer app. SAS is providing these killer great applications, also in a common platform that's reusable, not just in this world of COVID, but also other areas in the industry as a common platform that you can use to build upon from a computer vision, AI, and learning techniques. And then all of this also combines not just the edge, but also has to communicate to the cloud as well. Next slide. So Paul, you want to talk about the conclusion?
Sure. So in terms of, I think you've kind of now, thank you, Jeff, for tying everything together. So now we have an analytic platform and an architecture that is now used for COVID, and as an opportunity for us as we recover from the pandemic. But what I want to leave you with is there's a bigger opportunity for us to accelerate innovation, and that can be realized in a post-COVID world. So everyone is really innovating now to try to come up with the best we can do on addressing the human side and the economic side. This work now will pay dividends. When we do get post-COVID, we'll be able to accelerate and get into a new phase of innovation, and we'll be able to reimagine our businesses and take what we've been talking about for digital transformation and really make that reality and go beyond 100% goals for companies, get them to 110% and beyond. So this is the opportunity for us. And again, I think the time to work is now to, again, address the two-headed opportunity that's in front of us today, and then realize the future when we get through this.
And I want to add to Paul and Shay is that the important aspect of not just workplace safety and AI-based techniques, some of the complications that we see within these areas, it's really about ecosystems. So it's really about how we all work together as kind of one entity to drive a common solution into multiple market verticals, whether it's a hardware-based platform at the edge or in the cloud, that's using a SaaS analytical machine that's at the edge or the cloud, and then having a common management system that's managing all of this remotely, like ZEDEDA, to the end user. And then working with those end users is critical for not just, the responsiveness and the recovery, but think of also the benefits of financial. Doing this quickly, doing this in real time is creating an environment that they can continue to run their business. And that's kind of what we're all about, is ensuring that our customer base is still generating revenue. They're keeping their workers safe. They're keeping their workers with a paycheck, right? That's the critical elements. Shay, I'll turn it back to you.
Thank you, Jeff and Paul, for joining us and for this great presentation. For the audience, I'd like to thank you for joining us at ZEDEDA Transform.